Good morning, everybody out there in Kansas City and surrounding areas. This is Matt Taranto.
Kathy Taranto. Morning.
And we are coming live from the worldwide headquarters of Aesthetic Hair Med Spa. And it's funny, there's nobody here. It's so quiet.
I know, it's too quiet.
Yeah, we miss all our staff and we miss all our clients and hope everyone is staying safe and finding fun and creative ways to get through this crisis. I know it's a very serious thing, but there's always silver linings. I mean, we're getting all this family time. We've eaten out on the deck almost every night this week. And
we also cleared out our dining room and turned it into a dance floor. So
yes, Kathy and my daughter are doing all kinds of choreographed dances. But we're doing our best, and we're going to get through this. As we say, we're going to learn a lot from this, and we're going to come out stronger. Hello to any of our staff who's watching this morning. We've created some fun activities for our staff while we're closed up. Our staff, we've kept them all employed, and we've started a book club to read books to learn more about our industry and just some ongoing training so that when we do open up, we're going to come back smarter and better than ever.
Definitely. Yeah. I'm going to talk about some Botox today.
We're going to talk about a lot of stuff with needles. I mean, think about it. Before I got in this industry in the 90s, the thought that somebody would pay to have a needle stuck in their lip was like, oh my God, really? And now I know better. Yeah.
So I have a question for you.
Okay.
Have you ever had Botox or filler? You're a man. So.
Oh my God. Really? Now I have to admit this. Yes and yes. Well, I'm in this industry. If I owned a restaurant, I would probably sample all the food there, wouldn't I? So,
I think you do it for other reasons than that.
But we'll go into that. I'm not afraid to admit it. And it is getting much more popular for men. But we're going to just kind of talk about the history of these products, neurotoxins and fillers. Feel free if you want to post any questions. We'll do our best to answer them.
Yeah.
But let's start with fillers. I'm going to show you a syringe of dermal filler right there. Okay, that is Restylane and Juvederm. Those are the two brands that are the biggest in this country. And we'll go into more. I'm going to actually inject that into a spoon to show you how much there is. But the history of dermal fillers is fascinating. So back in the 1800s, right after the hypodermic needle was invented, okay, so hypodermic needle is a needle used to inject things into a body, a hollow needle. It's amazing. People started trying to inject things into their face. And the first thing ever tried was wax, literally warm wax. Injecting, they were trying to make faces look better. Well, as you can imagine, that didn't work very well. Then they started heating up what is very similar to Vaseline, petroleum jelly, and injecting that. Well, as you can imagine, didn't work very well. Yeah. There's been stories of caulk and all these things that, obviously that's horrible, it's dangerous, never do that. Now, what eventually happened in the late 70s and early 80s is they started deriving collagen from cows. It was called bovine collagen. In fact, when we opened Aesthetic Hair in 2001, that was still the only thing out there. It was FDA approved, and to be honest, it worked very well, but it was very, very, there was hindrance to it. You had to come in 30 days before, we had to skin test you, and if after 30 days you weren't allergic to it, you could have it. And that's really how we started back in 2001, because it was not until 2004 that the really good stuff came out, hyaluronic acid.
And previously, if something went wrong with it, it was kind of hard to fix.
Well, there was really no way to take that out of there.
Yeah.
And so that's another blessing with the new stuff. But in 2004, hyaluronic acid got approved by the FDA. And what's beautiful about hyaluronic acid is it's 100% natural. It is in every cell in your body. So you cannot be allergic to it. We do not have to skin test you. And what Kathy just said is amazing. In a worst case scenario, let's say you had some dermal filler that was a hyaluronic acid, and for some reason you didn't like it. Mm-hmm. There's a product called hyaluronidase that we can inject, and almost immediately it disappears, it's gone.
So we actually just got a question from one of you watching, and it is, so if you get it injected in your lips, how can you get rid of it if you don't like it or if it's too much?
Exactly, you can get rid of it almost immediately. And the lips, I think, are a good question. We get a lot of people who come in here and say, I would love fuller lips, but I do not want to do filler because I don't want those monstrous duck lips.
Well, yeah, it's kind of like this one.
Yes.
I just got this off the internet.
Yeah.
I mean, nobody wants to, most people don't want to.
Most people don't. And you know what? We don't do it. Even if you came into Aesthetic Hair and said, I want these giant, massive lips, we wouldn't do it. We really don't want people walking around Kansas City saying, oh my God, look at these giant things. I got them at Aesthetic Hair. Mm-hmm. So what's our favorite injectable saying here?
The best injectable is the least detectable.
That's right.
So I think I passed that quiz.
Our belief is that we want you to look more youthful, younger, obviously, but we want you to look like you. We want you to look natural. And so let's talk about dermal fillers and the most common places they're used. So you had asked me, where have I had dermal filler? I'm going to ask you, where have you had dermal filler?
I've had filler in my lips. I've had it in my cheeks. I've had Sculptra, right in here to kind of build back my face so I don't turn into a peanut type of
Really?
shape. Yeah.
Yeah. Well, obviously none of this is a need. This is a want, and Kathy is absolutely gorgeous, just the way she is. But the most common areas for filler are the tear troughs, because as we age and we get shadowing, we get recession there, and tear troughs can be wonderful for dermal fillers. You want to make sure you have a very experienced injector. The tear troughs are a little tricky. Cheeks can be amazing. I think most people don't think about that. But when you fill the cheeks, you can get a lift, which helps this area of the nasolabial fold.
Right, which I think most people, originally we started injecting too heavily here, and most of us were losing volume up here. So it makes more sense. Why not add it here and then pulls that back so you get a better overall effect by starting here.
Exactly. So cheeks can really, what's neat about cheeks is it's subtle, but my gosh, when you look at before and afters, people just look much more youthful. Now the nasolabial folds, these lines from, which I have pretty good ones, from here to here, marionette lines. We get some people coming in and saying, God, I look in the mirror and I look sad. I don't feel sad, because they're losing tissue volume here. They're getting this downturn. And so filling that area in there can make that really return to the way you used to look.
And one of my favorite areas that Judy injects for me, which I probably needed, I haven't had it for a while, is that, I grew up, I have dimples, and over time my dimples have turned into wrinkles. And so she takes filler and just very superficially fills those little tiny fine lines so that my dimple stays a dimple and doesn't turn into a deep wrinkle.
Yeah, it's amazing, and the other area, of course, would be lips. So tear troughs, cheeks, nasolabial folds, marionette lines, and lips. Those are just the most popular areas. And the dermal filler, we can do a lot and we can do a little. And really, I think the best injectors have kind of an artistic quality. They can look at a face and they can say, okay, here's where more volume is going to help you. And this is really kind of returning you to the way you used to look. I promise you, all of you out there, if you look at a picture of yourself when you were 7, 8, 9, 10 years old, you had rounder cheeks.
Yeah, and so actually we just got a question that came in. Hey, Meredith, she wants to know, how do I know what I need?
Well, the best way is to have an amazing injector. Because, and again, the word need, we don't like to use the word need. I would say, how do you know what is going to make you look the most youthful? Okay. And so our injectors, and we have wonderful injectors. And listen, if you're out there watching and you've never been injected before, of course Aesthetic Care would love your business. But wherever you go, just make sure you know how they were trained. Kathy and I have worked with over 1,500 clinics in North America. And I can't tell you, I firmly believe 80% of them are dramatically undertrained. Our injectors go through continual training, never ending. In fact, our lead injector, who's been injecting for 25 years, she still goes to 2 or 3 courses every year. We bring international trainers in. Our goal is to have the best trained staff, and the end result there is better treatments, and hopefully we get more referrals. So just be thorough that the person who's injecting you is confident, they know what they're doing.
Yeah, and I think there's so many things in our life where I walk in the door and I say, I trust this person so much. Do what you think is best for me, whether it's my hairstylist or my stylist at Nordstrom.
Your doctor.
Or especially my doctor. And so with our nurses, they're so amazing. I just prefer to sit down on the table and let them do what they think is best for me. And I think that's always the best result when you have that amazing injector.
Yeah. So a nice thorough consultation, and we're very disciplined with before and after photography, because some of these changes are subtle and they're not like boom. If you went and have a facelift, believe me, you're going to know you had a facelift. If you have a breast augmentation, you're going to know you had a breast augmentation. But some of the things we do, it takes a little time and stuff, and so we always want to show you photography.
And one of our clients just mentioned how amazing Tara is. She is an amazing
Tara's
injector,
a rock star injector. And I will tell you, we have Judy, we have Meredith, we have Tara, we have Noreen, we have Ardith. Am I missing one in there? But we just have amazing injectors.
Yes.
And we're also a training center. We've trained hundreds of clinics around North America in injections. So
one more question for you from someone that's on. How long do they last?
That's a great question. So let me ask you, when you get it, how long does it last for you?
Well, it depends on the filler. So the filler that I have in those tiny little lines in my dimples doesn't last as long.
Because it's a very soft filler.
Right. So it's like 6 months to a year. But most filler lasts, 12 to 18 months.
Yeah, and in the area, we use different fillers for different areas, because like the filler for your cheek is going to be a firmer filler, and you don't have as much movement in your cheek, so it's going to last longer. The filler in your lip is going to be a very soft filler, and you have a lot of movement in your lips, especially somebody who talks as much as I do. She would agree. So it's not going to last as long, maybe 6, 7, 8 months. Some fillers will last 18 months. There was a study out there for, one of the most popular fillers for the cheeks is called Voluma, and it's a wonderful filler. The study showed that it could last more than...
You forgot Nikki as our nurse.
Oh, Nikki. Oh, my God. And Nikki's a super rock star. Nikki used to be a cheerleader for the Chiefs, and she's awesome. But the filler in the cheeks, Voluma's study showed it could last more than 2 years. But the study was also with 6.7 syringes, which would be very rare. But some of the questions I get the most is, does it hurt? How do you handle that discomfort?
Well, number one, we use numbing cream. And I think that's important. A lot of clinics don't. So we'll use a topical numbing cream to help with the discomfort. I personally don't think it hurts, but I think just being in the industry, maybe, we all have different pain tolerances, and I'll lay on that chair, and I think I just trust our injectors so much that I really don't find that there's, different areas you may feel a little bit more. Like lips tend to be more tender with filler. I always say on a scale of 1 to 10, 10 being extreme, it's a 2 or a 3 on my lips. In other areas, it's like a 1 or a 2. Some people may be up there to like a 4. But, I think filler, you definitely feel more than Botox. Like Botox, I could fall asleep.
Well, it's a bigger needle, but the other thing, we do everything we can to make you comfortable. So the numbing cream and the fillers now have lidocaine in them. So once that initial stick is in there and the lidocaine starts going, it gets much more comfortable. And the other thing, one of our favorite toys here is something called Pronox, which I happen to love. It is a very lighter version of the nitrous oxide that dentists use. And we have this available for people who you might be a little needle phobic, or maybe you're just hypersensitive. You breathe some of this in, and I'm telling you, it just relaxes you and just makes you, it's fine. It also has a little amnesia quality, so you're like, that was no big deal. So that's good. Now, some of the other questions that I get are dealing with cost. And so fillers are not cheap. They really aren't. And it's a very expensive product to make. A half syringe could go as low as $350, where some of the longer lasting syringes like Voluma can be up to around $750.
And Sculptra?
Sculptra,
it's different, I know, but...
Sculptra is a very interesting product because this here is a dermal filler, and you can see the liquid in there. That's hyaluronic acid. And Sculptra really is not a filler. It's putting in basically almost seeds that attract your body's collagen and moisture. And Sculptra is really good, especially as people age, like you had said, for the temples in this area as you thin out.
Well, isn't it true that they first developed it for AIDS patients?
Exactly.
Because they were losing bone, basically.
And they're losing all kinds of, they were emaciated, yes. And so Sculptra, and at Aesthetic Care, we carry a very wide variety. Most of the best fillers we have in stock. And again, your nurses are going to let you know which is good for you. Now, another question we get is, well, how many of these will I need? And it's a great question, and it really depends on the area being treated, but also one of the areas of biggest disappointment with dermal fillers is people will say, listen, I can only afford 1 syringe, but I want my cheeks, my nasal bit folds, and this done.
It's impossible.
It's impossible because if we spread that out over there, you would never know anything was done.
And is one of those going to equal this look?
No, that's like more of a gallon.
Yeah. Yeah. So, I think that's also one of the big questions I get for someone that's a virgin to filler is 1 syringe going to make me look crazy? And so I think this shows not only, no, 1 syringe isn't going to make you look crazy, but also 1 syringe can't fill your whole face.
Right. So I want to show you, I've got a spoon here, and I'm going to put this dermal filler, let me get right in here, into this. You can see it's going to take a minute. I don't know if you can see this. There, I'm going to try to. So you can see it's a little bit thick, but I'm squeezing this into a spoon. It's almost done. There, it's done. And now I want to show you. I don't know if you can really see this.
Let me see if it's overflowed a little bit. Oh, we should have used a different color spoon.
This is not working so well. But there's, to be honest, it filled maybe a quarter of that spoon. It's like a gel. Okay, that's hyaluronic acid, and it filled about a quarter of that spoon. Yeah, there you go.
That's it.
There it is. And so when you think about that much, trying to spread that throughout your face, you're just going to notice it. So again, a good injector is going to advise you on based on, hey, what can you afford? What fits your budget? And then in that budget, where will it best be used? So somebody in the cheeks may take half on each or may take 1 syringe on each. Same, it might be half of a syringe on each nasolabial fold, or if they're very deep, 1. Lips usually a little bit less. And again, keep in mind, they don't have to inject the entire syringe. If you want just a little bit of accentuation of the Cupid's bow or something, you can have subtle improvement as well.
I think one of the things I love about it in my lips is that as I've gotten older, my lips start to look like a deflated balloon. And like lipstick goes on, it just doesn't go on the same. No, it's true. It's true. And so with just a little bit of filler, it helps to fill that deflated balloon, that it just looks more plump, just like I was when I was younger, not over accentuating it, just making it look natural.
Yeah, they've gotten amazingly popular. Again, extremely safe, 100% natural, 100% correctable if you don't like it. And again, that's very rare. Now, the other thing that I get asked a lot, and we get questions, what are the potential complications? What could go wrong? Hey, like any treatment, there are complications. The biggest one, and it's not big, is bruising. When you stick a needle into somebody's face, you can get a bruise. It doesn't mean the injector made a mistake. It's just there's vessels in there that were nicked. Bruising goes away. In fact, we have a device here called BBL that can usually take a bruise and cut that lifetime of the bruise in half. But that can happen. That's why you'd be advised, a couple days before to lay off any blood thinning type things like aspirin. Obviously, if you're on medical or prescription blood thinners, you can check their doctor, see if you can go off them for a day or two. Fish oils, the night before, not to drink too much. Anything that'll thin out your blood would give you a better chance of getting a bruise.
But if you look at the anatomy of the skin and the body and you look at a diagram of vessels, I mean, it's shocking how many we have in our face. So it's amazing how our injectors are able to work around that, where we see very few bruises. But it's not that big of a deal. It's going to happen.
And they're going to happen. And again, I've worked with clinics that, oh my God, that woman injected me and she gave me a bruise. I'll never go back. Getting a bruise does not mean the injector was bad. Okay, there was just a vessel there that got nicked. The other thing, another complication that can happen, this is why somebody has to have very good understanding of facial anatomy, is you could occlude a small artery, stop the blood flow. If that happens, a well-trained injector, and it will happen every once in a while, will use some nitrous paste, massage it, and it's corrected almost immediately. But if you're not a well-trained injector and you get injected, that could literally cause death of tissue, which could be very significant.
Right.
But there's very few complications that happen, but we're going to always be honest with you and inform you about those.
Hey, Erin.
So, hi, Erin. Thanks for joining us. Erin Hennessy is all the way from Ohio. She's a nurse practitioner, and she is amazing. We love her to death.
We do.
So, okay, so fillers are fun. And again, mainly all over the face, temples. I mean, really can be artistic, jawline. Another thing, hands. As we age and you start seeing more and more veins and the tissue just gets off, we can do some amazing things on hands. And really, there was a poll done, and they asked women how they judge their age. And number one, of course, was the face, but number two was their hands. And so we can do some really cool stuff with hands. Okay, let's move on to neurotoxins. Now, when you go into the store to buy facial tissue, does anybody ever say, ooh, I'd like to buy some facial tissue? What do they say?
We say Kleenex. Where's the Kleenex?
Kleenex is a brand name, but it's taken over. So that is Botox. But Botox is not the only one out there, but for years it was. And so let's talk about neurotoxins. And a little bit, the history is very interesting again. So in the 1800s, they started having trouble with people dying of eating certain things. They couldn't figure out what it was. And there's actually a wedding party of 34 people back in the mid-1800s. And 34 people, either they died or got very sick. And there was a scientist who was able to look at some of this food. It was salted ham, and they found this poison there, and they called it botulism. And they started figuring out how that affected foods and protecting foods, because that is a deadly poison. In the 1940s, a scientist discovered a protein in botulism that basically caused a block from the nerve to the muscle, so a temporary paralysis. And so this started being played with, and they figured out a way to purify this protein. And in the early 1970s, Botox became FDA approved for things in medicine, not in cosmetics. And that's a thing I think a lot of people don't know, because they hear Botox, they just think the face.
Well, yes, but I think one of the number one things I get asked is, you're injecting poison?
Yeah, no, and it's not, because obviously we would be in prison. Just think about when you take penicillin or you take an antibiotic, you're not eating mold, but penicillin was derived from mold. Same here, this is a purified, totally safe. So in the 70s, it started being used, and now it is extensively used in medicine, things that are covered by your insurance, covered by Medicare, such as cerebral palsy, involuntary muscle twitches, bladder incontinence, lower back pain, migraine headaches, excessive sweating, which we call hyperhidrosis. These are all used in medicine. In fact, now when women who have gone through breast cancer and have had reconstruction, when they do the reconstruction, they inject a large amount of Botox in the muscles in the chest to relax them for the stretching. So there's so many things that go on in medicine. Now, what happened, it was kind of interesting. There's a few different stories, and we don't know which is exactly true, of when this first started to be used cosmetically. But one of them comes out of Canada, the Carruthers, a husband and wife. One, I believe, is a derm, one's a plastic surgeon. And one of their employees had a little muscle twitch right here, which this is FDA cleared for muscle twitches. And they injected the Botox, and they looked a couple weeks later, and they go, wait, hold on, you have no wrinkles here, and you have wrinkles here. So they started playing with it. And soon found out that this was amazing to prevent the contraction of muscles in the face. So in the 90s, it really started to get popular. In fact, it got FDA cleared, okay, for this. That's the only place it got approved for, the glabella area. And it just took off.
Mine's still working, I think.
Now, as we know, Botox, Dysport, and Neurotoxins are the #1 most popular cosmetic treatment in the world, and it's not even close. So, one, we always want to tell people, if people say, is it safe? It's been out cosmetically, okay, for 40 years, and there virtually are never any problems. In fact, Botox used properly, there is never a problem. Now, there's been some issues with artificial Botox. So what I want to show you here is a vial of Botox, and this is pretty interesting because I don't know if you can see this. It looks literally like a vial of air. There's no liquid and there's no nothing. It looks like an empty vial. The first time I saw this, I'm thinking, oh, this must be a used one. In the very bottom, if you look closely, there is, I don't know if you can see this, it looks like a little tiny layer of dust. And that's it, it's minute. And we put saline in there because you have to have a substance to inject. But with Botox and Dysport, there's always gonna be a hologram on there to let you know that this is authentic. There's Botox, artificial, counterfeit Botox coming in from South America, from other countries. That is a felony, that's illegal. And one thing we always say, if you ever see some ridiculously cheap price on Botox, it should raise a red flag. There was 3 clinics in Kansas City that were shut down by the Board of Healing Arts and the Attorney General for importing counterfeit Botox. And so it still goes on. And so you just want to make sure you're using authentic Dysport or Botox. Now,
so did you clarify what the difference is between Dysport and
That's
Botox?
where I was going next.
Oh,
She's
look at
always
that.
just
Look
one
at
step
that.
ahead of me. So there's actually now there's 4 dermal fillers that are out there. There's Botox, there's Dysport. Neurotoxin, I'm sorry. There's Botox, there's Dysport, there's Xeomin, and there's Jeuveau, which is the latest one.
I love how Erin was saying, you know, we call Botox Kleenex, but Dysport could be called Puffs. It's just another brand.
There you go.
Yeah.
So what is the difference? Well, before we ever launch anything here, I don't care if it's a laser treatment or injectable, we try it a lot because we want to be able to tell our clients honestly, how does this perform? So we all know for years Botox performs brilliantly. So the next one that came out was Dysport. In the United States, it was out. Dysport is actually, from what I understand, bigger than Botox in Europe, and here's how it is. Dysport, it took a little while to figure out how many units of Dysport were equal to 1 unit of Botox. And we measure Botox by the units. And Dysport, it turns out 3 units of Dysport, we believe, are exactly equivalent and perform just as well as 1 unit of Botox. So we carry Dysport and Botox because they both work absolutely brilliantly. When Xeomin came out, we were excited because it was much cheaper, and we tried it, and we probably tried it on 75 to 100 people.
It was cheaper for us to buy. It's not usually cheaper.
Well, no, we were able to offer it cheaper too, and a lot of clinics will claim, you know, it's just as good. But what we found is it just does not last as long, to be honest, and we did not want to offer an inferior product to our clients. And then last year, another exciting one, Jeuveau, a big push, and they called it Neurotoxins. And we were excited about it because the studies looked good and everything. But the same thing happened. We injected well over 50 people, and our feedback was, my gosh, this just does not last long. Sometimes we were seeing only 6 to 8 weeks. And again, we just made the decision we're not going to carry an inferior product in our clinic. So Dysport and Botox, we think are wonderful. We carry them both. Now, some of the questions. Does it hurt?
No. I don't think it hurts at all.
No.
I mean, the needle is so small. It's it's an insulin needle.
It's a 31 gauge, tiny.
I mean, it is tiny, and our injectors are great at switching out the needle. So it's not one needle. For me, I mean, I have Botox in my forehead, I have it in my glabella, I have it in my crow's feet. And so the needle gets switched out multiple times, which means that you feel less during the injections.
It is, to me, it feels like a teeny pinch, and that's it. It's no big deal. And people, they're worried about that. Now,
well, but the first time I had Botox, I had it with an injector that was what I would say a more aggressive injector, and it felt like he literally was like using all of his might to come at me with the needle, which I think a lot of people are still experiencing. Whereas our injectors are so graceful and so gentle that you literally, if you were to close your eyes, you take a couple of breaths and it's almost truly like you could fall asleep. Yeah. In my experience.
It's pain usually is never an issue with Botox. Now, can you bruise? Yes, but it's much rarer than for filler. It's a much smaller needle going into areas that are not as vascular.
And it usually looks more just like a little red dot on the skin versus like a bruise.
Well, and after Botox, usually 5 minutes after you've had it, there's nothing. You go back to work, no big deal. Now, how long does Botox last and Dysport last versus dermal fillers? It does not last as long. What do you get out of it?
I get about 3 months. I mean, I burn through it pretty quickly. I think some people, it lasts a little bit longer than me.
Yeah, I get about 4 months. So I have Botox or Dysport. I can't remember what I got last time here, and I have a little bit here. So normally I have 2 very deep lines here, what they call the 11s. But as you can see with Botox and Dysport, they're virtually gone. Now I can still move a little bit because most people want a little bit of movement. We do get people who say, I want no movement there, and that's fine. We can do that too.
Well, on me, it kind of it wears off differently in different zones. So it tends to hold on longer here. But so you can see, like, I have a little bit. I mean, I need Botox. I wish our injectors
She wants Botox. She doesn't need Botox. She wants it.
No, I need Botox.
Yeah.
But here I have a lot of movement in my forehead, and you're starting to see quite a bit here. So it just wears off a little differently depending on the zone, even on one particular person.
I'm telling you, a lot of people say, "Hey Matt, why did you marry an older woman?" And she's 20 years older than I am, but look at her; she looks so good. So the other thing is, what are the dangers? I'm telling you, done properly, there just is no danger. And now some things can happen as far as there could be asymmetry. If you get a little more here, there, and stuff, asymmetry can normally be fixed with a touch-up. And so...
How does that work? How do touch-ups work?
So touch-ups, we always want, especially if you're new, because once we've injected you a few times, the nurse, they get to know your anatomy of your face and what is going to work best. But we have people come in 2 weeks after, and we look at them, say, okay, how much movement do you have? Is there any asymmetry? Because, listen, Botox and Dysport, we can always add a little bit more. You just can't take it out. Dermal filler, you can get out of there right away.
So what if you do too much in the forehead? I mean, what is the main thing that we see that we don't like?
Oh, well, yeah.
You can get drooping.
What it's called, yeah, I missed that one. So you can get a little ptosis where you get a little drooping, and there's some drops, eye drops that help that. It goes away. I mean, and again, it can happen. Things can happen. But the better your injector, the safer you're going to be.
Right, and to your point, we would prefer to inject a little bit less than we think needed and do a touch-up
in 2 weeks
versus versus the opposite. So we just got a question: can you get Botox when you're pregnant?
Well, here's what I would tell you. We work with a very good guy who's got a PhD in biochemistry. He's a clinical dermatologist. What he says is there's no danger, but that being said, we would never inject anybody who's pregnant.
Right. It's
more of a legal issue because anytime if there's an issue with the baby, they're going to sue everybody involved. So we would certainly recommend that you do not have anything injected that's not absolutely necessary when you're pregnant.
Right.
It's safe.
Although having had a baby, it's like the one thing you really, really want because you feel so tired, and especially the baby comes, and then you still need to wait for a little bit. You need to wait until you're done breastfeeding. So, and then once you have it, it's like you just feel so rested, even though you're not sleeping.
It is. There was a poll done of people who have had Botox one time. 98% said, I want it again. I mean, it's just so popular. And again, done right, people shouldn't know, oh my God, you've had Dysport, you've had Botox. It's like, wow, you really look young. What did you do?
Or just rested.
You look rested. So it's amazing what these injectables can do. There's a buzzword in our industry now called the liquid facelift. And it basically is really making people look dramatically younger with no surgery, just using fillers and neurotoxins. And so, the majority of people that get neurotoxins are coming in every 3 or 4 months. The majority of people that get fillers are coming in every 6 to 18 months. And the thing that I did see a lot of people asking questions about is, how can Botox prevent?
Oh, yeah, that's right. We did get that question, didn't we?
Yeah. So, the thing is, think about, everybody's different in their musculature. There's some people in their 20s that can raise their eyebrows and they have huge, the big distinct horizontal lines. They scowl and they get these big lines. So we get a lot of millennials doing Botox now as a way to prevent those wrinkles from becoming permanent.
Right. And so, speaking not about a millennial, but someone a little older, somebody that's 40 or 50, if they were to come in, can you do Botox or neurotoxins, Botox or Dysport, filler, a hyaluronic, and Sculptra all in the same visit?
Sure. Well, you could. I mean, they complement each other, and some people that is going to be the best solution to
definitely.
it. And but again, the consultation, if you've never had these, the consultation is so important. Just to be able to chat with somebody who is a true expert, can look at your face and be very, very honest about what you're going to be able to achieve. I think a big problem in our industry is there's a lot of overused adjectives. Oh my God, do this, you're going to look 20 years younger. It's not a magic wand. It's not poof. Okay, if it's done properly, it is amazing. And another thing, this used to be primarily done for women. Yeah. But we are seeing the fastest growing segment of the aesthetic industry is with men, because it is getting more acceptable for men to kind of worry about what they look like too. And so we're seeing more and more men that do it, and satisfaction of men is sky high. They love it.
Right. I don't know why they wouldn't. Why have they waited so long?
It's just, society and men doing things that, men don't care what they look like, women do. But I think that's changing. I think that's changing a lot. But I will tell you, we're blessed to have a clinic. If I'm not mistaken, we're the #1 injector in this geographic area of neurotoxins and fillers.
Because our amazing team.
Yeah, we have 6 just wonderful injectors. And the thing is, we're very unique. I think we're one of the only clinics in the nation, we're the only one we've seen that has an amazing advisory board. We have a clinical dermatologist out of Vanderbilt, who the one I was talking to is a PhD in biochemistry. We have one of the nation's top plastic surgeons on our advisory board out of Dallas. We have our medical director, who's an OBGYN anti-aging specialist. And why don't you tell them about what she does for your headaches?
Oh, Dr. Carter. So I have had migraines off and on my whole life. Well, pretty much since I was a teenager, probably the hormonal shift, but there's a number of different causes. And they kind of come and go, but over the last couple of years, they've really increased or come back. And so
it's because she lives with me.
No.
I know, I'm kidding.
So she injects me for my migraines, and it's amazing the difference. I mean, I was going from having 20 out of 30 days having a headache of some type, whether it's a tension headache or a migraine, but some type of headache. And once she injected me, I would say 95% of those headaches are gone. And when I get them, if I have that 5% that's left, it's like a really mild headache. I put a little peppermint oil on my forehead and on my temples, and it's gone. I'm not even having to take Advil or anything. So it's dramatic. And Noreen actually also injects. She has the masters and the temporals for headaches here at Aesthetic Care.
It's pretty amazing. I mean, she injects some here in the traps, some in the skull, because these are headaches caused by muscle, and it is FDA approved for this. And I will tell you, I mean, obviously we spend a lot of time together. The difference in the quality of her life is amazing. And so that's another thing that is
I'm probably
very
a lot
cool.
nicer, aren't I?
Oh, she's always nice. Kidding. She is. She's always nice. So yeah, that's pretty amazing what it can do for headaches.
Yes.
The other thing is a lot of people, and there's a lot of dentists who use it for people who grind their teeth, and they inject the masseter muscle in here to prevent that. I've got quite a few friends. One of my old employees used to do that, and it worked really well. So they're finding all kinds of new uses for this and things. But we hope you enjoyed this session. We do want to remind our viewers that if you go to our website during this crisis, every week we are choosing a first-line responder, whether it's a doctor, a nurse, somebody working in a hospital, a police officer, utility person who's out there, they can't stay home. And every week we're picking nominate anybody. We're going to read through the nominations, pick a really deserving winner for complimentary treatments. We want to make sure that the people out there busting their tail to keep us safe are being recognized, and we want to do everything we can do. Our staff, we have this wonderful staff between the two companies of about 32 people, and they're all staying home, and we're doing our best to communicate with them, and all of us keeping our spirits up. We're having a staff happy hour coming up here on Thursday, and we've done our book club. So we just want to let you know that we are staying engaged during this. We're going to have another one of these live things, I think, on Facebook on Friday. And if you're watching on Friday, this is going to be interesting. So since we're down.
Okay, but are we doing your treatment before or after?
Right after.
Okay.
Right. So Kathy's going to really go after it with Halo, BBL, Plasma Pen. She's going to do some crazy stuff So that'll be Friday to me. And then when we do the next one on Tuesday, you'll be able to see kind of what happened. Maybe we'll do it before. Maybe we'll do the treatment before the live so you can see what I look like. But she's going to take a little age eraser to my face and see if she can make me look that good.
Oh,
that's very hard. But we sure love you guys out there. We love our staff. We miss our clients. We can't wait till we can open and start taking care of you all again. Tune in on Friday for another session with Matt and Kat.
The Aesthetic Care Skin School.
That's right. And enjoy this lovely weather. You know, I know we're quarantined, but we can get outside. The next 3 days look amazing. And we're here for you. And we're just excited to see you again.
Hopefully see you soon.
Yes. Take care.